Now what we are going to today, we are just revise the previous topics because the revision classes is here up to 20, date 20. So today we revise the lipid biochemistry and lipid metabolism. Okay, lipid biochemistry and lipid metabolism. So all of you just take your copy and make some notes which is important to study it. Okay, I will tell you clearly which topic is needed to read as per your syllabus, as per your university exam. Okay, which type of questions asked in your examinations and how much matter you write it. Okay, so before going to discuss about that, I just going to discussing about the uh, question paper which you already attend in the semester exam. Okay, so students, your writing whatever you studied in your hostel, whatever you studied before the class, okay, and how will you write in your copy, how will you write, give the answer in your copy is a different thing. Understand? To read a topic is a different thing, and how will you attend the exam and how concerned matter is you will write in your copy is a different thing. Because in this semester exam, those students are come taking marks and who are not uh, who are not regularly comes in the class, but they are doing hard work. When the result published, you all are getting surprised. What happens? What happens to those students who are regularly doing studies? Those who are regularly doing study just come near to the boundary mark. I am not discussing about the mark here. I am just telling you how will you write it in your copy and how will you get the maximum mark. Understand? So today we are going to just about the lipid chemistry. Okay. So in the lipid chemistry section, all of you know that when we see the chemistry of the lipid, it is basically started from the classification and definition of lipids. Okay. It is long answer questions. Okay. The first long answer question is asking about and give the classification of lipids with example. This is a long answer question which is asked in your exam. I think you all are know the pattern of the examination, university examination paper, that there are two questions asked about 15 marks and rest of three questions asked is two questions asking 10 marks and after then 5 marks, four questions asking. Okay? Huh? I will tell all the things, don't worry. So these questions may ask in the university exam in this pattern. The first question is asking define lipids and give the classification of lipids with example. You already know because these are the topics we discussed in this class in very broadly. Okay. So anyone can tell me the definition of lipids from you? Anybody else? Because this chemistry portion is also in your semester exam. So I think you are capable to give the answer of this question about the definition of lipids. Just raise your hand. Who wants to give the answer? Student, wake up from your sleep. ये देखो. Wake up from your sleep. Give the answer of lipids. Anybody else? Aragrip. These are organic inorganic, non-organic, what kind of substances? These are insoluble in water, colloidal in nature, huh? Non-volatile. Okay. So there are proper definition of the lipid. And if we classify the lipid, it's mainly classified as simple lipids, compound lipids, derived lipids, and miscellaneous lipids. If we more classified, it is as oil, wax, compound lipids, only phospholipid. Okay. Tell me phospholipid next. Lipoprotein. Next. Glycoprotein. जो आप बोल रहे हैं वही लिख रहा हूँ. That's why I say wake up from the sleep. Glycolipids. Next. Sulfolipids. Okay. This is glycerophospholipids. This is sphingophospholipids. Okay. Now derived lipids. What is the definition of derived lipids? What is the definition of derived lipids? They are derived from group 1 and group 2. This is group 1. This is group 2. Okay. Cholesterol, fatty acid, triacylglycerol, now last one is miscellaneous lipids. What is the meaning of miscellaneous lipids? That is, what is the meaning of miscellaneous lipids? Why? Have you know the structure of sterols? Cyclopenta, phenethrin, ring structure. Yes, CPP. Cyclopenta, phenethrin ring structure. That is 17 carbon atom molecule structure, which the structure is already given in your book. And this structure is important regarding your spotting. Understand? In the spotting exam, I will give the structure and not mentioning the name and ask the question, identify the structure and write the total number of carbon molecule which is present in this structure. And that is cyclopentaphenethrin ring structure. That is 17 carbon atom molecule. Okay. So, when we see the structure of cholesterol, this sterol structure is present. Okay. So, on this structure, which are comparatively similarity with this structure, like vitamin A, which have sterol ring in their structure. Vitamin D, steroid hormone. So all are what? Miscellaneous. Okay. But the question is asking, that is, you are always confused, sir, how much we write when the question is asking up to 10 marks. Understand? So maximum you have to write 2 or 3 pages. First thing, 2 or 3 pages your content is very clear and you understand that what the examiner wants. Because if I will talk about there is lipids, if this question is 5 mark, I just give the definition of the lipid and give the chart which can give the classification of the lipids. This is up to 5 mark. But when the question is asking up to 15 number or 10 number, what I will give? I will give the definition of lipids. I also note the function of the lipids, mention 2 or 3 or 4 functions. Okay. After then give the classification in detail. Definition of oils, definition of waxes, definition of phospholipids, function of phospholipids. Okay. All are important from this chapter. The first question is that. Now the second question, which is asked another in a short answer question. That is, the first one is essential fatty acid. Fatty acid, you already know, very important topic which is already coming in your exam. And the question is asking, what is the question? Question क्या था? Yes, different classification of fatty acid. अभी you all are confused. कैसे उसका आंसर देना है? First thing is on the basis of number of carbon chain. On the basis of number of carbon chain, first thing, short chain fatty acid, medium chain fatty acid, very long chain fatty acid. Okay. Now the second thing is on the basis of saturation, mono unsaturated fatty acid, polyunsaturated fatty acid. Okay. Now on the basis of essential nutrition, on the basis of nutrition, that is essential fatty acid, non-essential fatty acid. Okay. And what is the function? Most of the students give the answer of this questions very clearly, but they don't mention the example. But the demand of the question is what? Classify fatty acid with example. If you not write the example, we definitely cut your mark. Understand? Most of the students knowing the answer of this question, but they are not able to present the answer in the copy very neat and clean. They are confused, highly confused. You just give the definition of the fatty acid and give the classification with example. Nothing. Question is over. Essential fatty acid. Second one is phospholipids. These questions may ask from this chapter either in long answer form like that, phospholipids, and right there biochemical function. So already you know phospholipids are a different type, sphingophospholipid, glycerophospholipid, and sphingophospholipid, sphingomyelin, lecithin. Okay. So all the phospholipid which is classified with their structure. This is nitrogen containing phospholipids, non-nitrogen containing phospholipids, sulfur containing phospholipids, all having different functions, which is very easy. In very easy form, it is given in your book. In the DM Vasudevan, there is a separate chart. Okay? You read it, this chart, and you are able to give the answer of this question phospholipid and write their biochemical function. Now from this function, the third question may ask in your short answer question, that is RDS, that is respiratory distress syndrome. Okay? Respiratory distress syndrome. You already know what is the meaning of this syndrome? Yes. In this RDS, we see the LS ratio. Lecithin sphingomyelin ratio. Why it is important? Who can tell me the answer of this question? Who wants to give the answer of this question? Lecithin. Yes. थोड़ा तेज बोलो. हाँ, सबको सुना दे. Okay, it is surfactant. So, what is the function of that? Okay. So, what is the incidence rate? The prevalence of this RDS? Yes. That is present in the immature baby. It is considered as, it is mostly considered as, it is present in the immature babies. What is the function of lecithin? They reduce the collapsion of alveoli of the lungs because it is act as a surfactant. Now fourth one, it question may be asked as plasminogen. Okay. Now here icosanoid. What is icosanoid? Huh? Yes, arachidonic acid. It is basically a pupa. But the function of this what? Very important function of icosanoid is that it is a precursor for the synthesis of prostaglandin. Okay? अभी सब याद आ रहा है. एग्जाम टाइम में सब भूल जाते हैं. Prostaglandin. Okay? So in the lipid chemistry section, the prostaglandin structure is important. PGI1, PGI2, leukotrienes, leukotrienes. Okay? So up to this you know well. आपको आना चाहिए ये चीज. Lipid chemistry 2. Okay, prostaglandins. We have briefly discussed about the prostaglandins in their class. आप लोग अगर क्लास में आए हैं तो हमने पिछली क्लास में ये सारी चीज डिस्कस करी है. Students, what is happening in your class during the exam? जो स्टूडेंट पढ़ते थे उनका परफॉर्मेंस सामने निकल के नहीं आया. क्यों? बिकॉज एग्जाम में आते आते उनकी प्रिपरेशन में शार्पनेस नहीं आ पाई. अंडरस्टैंड? Those students who will write in their copy very clearly and give the answer of every question, giving highest mark. But this is the first semester exam. All of you doing well because most of the students are getting passing mark. How it is possible? Because there are the norms for first semester which is important to all of you, that the question is the student being passed if they getting passing mark in the practical exam plus theory exam. So from this benefit most of the student getting passing mark, but I am not happy with your performance. अभी बहुत लोग सोच रहे होंगे सर फैकल्टी तो कभी हैप्पी होती नहीं है, हम कुछ भी कर लें. but it is not important for your first semester. It is important for your last semester, for the final exam, that you perform well, you getting passing mark. You all are doing well if you want to try it. Just read it carefully, the metabolism, because in the first semester there are the least syllabus which is comes in your exam. We already discussed some of the chapter we left out, like lipid chemistry. Lipid chemistry आया था, nucleotide chemistry, nucleic chemistry, all the chapters, important chapter we left out. But during the semester, second semester, all this comes up to metabolism, molecular biology, vitamins, nutrition, cancer biochemistry, all the important topics are comes in your exam. So now this is the trigger time to all of you. Just go to room and make the notes and continually study. Understand? Do work hard. What the people think about it, just leave out. Just go to your room, take the books and read it. Make the notes, make the exam preparation first. I know there is already a pressure of different other subject to all of you, but it is kept in your mind that all the subject is important. If you are not passing in one of the subject, you are not promoted to the next year. So what is important? You give the time to all the subject, and it is important that you have to perform well in all the subject. At least you getting the passing mark from that. But if you want to try to get 75% of the marking, you are working to 75%. That's I mean you have to be able to getting passing mark. So all the things depend on you. Just left out whatever you perform in the first semester, you do for second semester. Work hard, and if you have any queries from the topics, you may ask to me. Okay. Now some of the topic from lipid metabolism. From the slide we show that what is important, what is not important. Just simply, so these are the important from lipid chemistry section. These are important from lipid chemistry section. Now, the first question which is asked as a short answer question to you. Write about digestion and absorption of lipids. Before starting the metabolism, the digestion and absorption is important. It is important for every molecule like carbohydrate, proteins and lipids. So this question asks up to 5 marks, and you will elaborate this in detail with the diagrammatic presentation. If you are copy, if you write the answer with your diagrammatic presentation clearly, there is no need to understand this question. Examiner don't want to read the theory. If you tell all the things from your diagrammatic presentation, then it is easy to understand the answer. After then, on the basis of fatty acid, it is omega oxidation of fatty acid, beta oxidation of fatty acid, beta oxidation of fatty acid, de novo synthesis of fatty acid, de novo synthesis of fatty acid, ketogenesis, and utilization. Triglyceride metabolism. Triglyceride metabolism. Students understand what is the meaning of metabolism here? That is synthesis and degradation. How the molecules are synthesized and in which particle it is degraded in the body. Okay? Triglyceride metabolism. After then cholesterol metabolism, cholesterol synthesis, we already discussed in the class in detail, that is 17-step process. Cholesterol synthesis, 8th one, degradation of cholesterol. Degradation of cholesterol. We all know the cholesterol being degraded in the formation of bile salts, in the formation of vitamin D, and the last one is in the formation of, yes, in the formation of growth hormone, steroid. Degradation of cholesterol. Okay. Now here up to this you will see what we have discussed. Triglyceride metabolism, cholesterol synthesis, degradation of cholesterol. 9th one is lipoprotein metabolism. Lipoprotein metabolism. Again what I say, in this metabolism what we are going to study is synthesis of the molecules and degradation. Yes. All the major portions like LDL, HDL, IDL, next one, VLDL, and we discussed also, the question I left out, that lipoprotein is also asked in your chemistry section, that is separation of the lipoprotein. That is IDL, VLDL, LDL, HDL and chylomicron. And chylomicron. All the metabolism, lipoprotein metabolism, HDL, LDL, VLDL, chylomicron. Here is important, one more important thing is here, phospholipids. metabolism. So students, what is the function of phospholipids? You can tell me. Tell me the three functions of phospholipids from the last page. From the last page, 1, 2 and 3, from this row, you will give the answer. Anybody else? Three functions of phospholipids, only three. Raise your hands, give the answer of this question. Three functions of phospholipids. That is not a very typical task. Anybody else? Yes. Prevention and accumulation of fats in the liver. Okay, next one. Transportation of cholesterol. Anybody else? From the last bench. Ayush. Give the answer. Lung surfactant. Good. First. Yes, cell membrane. It is present in the plasma membrane. Phospholipids. Third one. I am not asking with you. Don't worry, I will make another question for you. Yes. It is used as a blood coagulant, plasmalogen, phospholipid separations. It is present in a brown tissue and white tissue for the signal transduction. So there are so many functions of phospholipids, but I am just asking only two. Okay, sit down. So this is the important about the phospholipids. Okay, lipoprotein metabolism. Now the question is asking from lipoprotein metabolism. It is just only in the exam in this format, justify HDL is a good cholesterol rather than LDL. Justify. It is question asked in this format. Okay? So whatever you write it in this question, you have to mention reverse transport cholesterol metabolism. Reverse transport cholesterol metabolism. You have to write it in this way. Either it is asked like that, fish oil is good for health. Justify. Fish oil is good for health. Why? So what is the function of omega-3 fatty acids? So what is the function of that? It is bone development. It is anti-atherogenic capability. Anti-atherogenic means they reduce the deposition of the cholesterol in the blood vessels. Understand? The question is asking like that in a different format. Now from this, from the phospholipids up to phospholipid lipoprotein metabolism. Lipoprotein metabolism is a very big topic. We discuss in detail in the class. You all see your notes and previous classes. You understand lipoprotein metabolism is important. Now the question is asking in the exam like HDL metabolism separately. LDL metabolism. What is the role of HDL, LDL, VLDL in the body? Okay. After from this up to this, the next question is asking in your exam from from the clinical condition which is associated with that. The first one clinical condition is what? Write about atherosclerosis. Second one is inborn error of lipid metabolism. Inborn error of lipid metabolism, that is Gaucher disease, some other disease, phospholipid storage disease. Atherosclerosis, yeah, and the important, very important, fatty liver and liver cirrhosis. If this question is asking in your exam, you will give the answer in the biochemical prospectus, not in a general way. Understand what I want to say? If the question is asking fatty liver and liver cirrhosis, what content do you write? From this side, Rakesh, if the question is asked fatty liver and liver cirrhosis, what content you write it? What do you think about it? Huh? Okay, it is basically 2 times non-steroidal alcoholic liver disease and it is drug-induced fatty liver. If this is question is asked in your exam, whatever you first thing you have to write it, you have to mention the fatty acid metabolism in the liver. And you also mentioning the symptoms of the liver, that is hepatomegaly, loss of perfusion of the metabolism, and what is happening in the fatty liver. And after then, the fifth question is asked and it is concerned with the disease, that is lipotropic factor. What is lipotropic factor? Student, you will study all this lipid metabolism in this concern and you are capable to give the answer of this question. What is lipoprotein factor? These are the substances which can prevent the liver to become fatty. Example is choline. So these are the lipoprotein factor. Sixth question may be asked in your exam, just like that. Obesity, myocardial infarction. Okay. So these all are the major portion of the lipid metabolism, and I think all of you understand well if you just take the reading of the notes day by day, and if you have any queries from this, you will ask to me. Understand? From the day 1 omega fatty acid, day 2 you have to go for study beta oxidation of fatty acid. Understand? With the role of hormone, insulin and glucagon, what the role of that. So all these are concerned. Last, whenever you studied all these three protein metabolism, they having integration with each other. And the last thing, to develop a confidence and to develop uh, whatever you studied in the subject, you have to read it first. At least you have to go for reading what the content said, and then after then you will make the answer of the questions. Okay? From that, I think from this day you have to go start it and read all this lipid metabolism. If you have any queries from this topic, you may will ask to me. Thank you.
Learning the brachial plexus. So it's a part of axilla which is we are going through in the dissection. I am not going to hold that axilla discussions in here. Rather, I will just discuss about the brachial plexus formation and talking about the brachial plexus, how to draw it and draw it in a manner so that we can just like identify and as well as we can answer during examination. So, pocket mat chesnaki. So, we are going to do this brachial plexus. So, axilla will which we are going through in a lab. We are not going through, we will be learning about the axilla contents of that. But the content of the axilla which you are going to do here, which is much complex than anything else, is about this particular brachial plexus. The drawing of the brachial plexus that you have to do, and we have to know about this particular brachial plexus in detail. This could be your exam long question in a semester or in a university exam or elsewhere. And not only this, the brachial plexus is a network or intrigue network of the nerve system which is present in the upper extremity. It also has number of clinical problems related to the brachial problem, nerve injuries. So we have to learn both of them. So for the day, we are going to stick our discussion on this particular learning and drawing about the brachial plexus. In the next lecture, we will talk about this particular nerve and the nerve lesions. And I repeat once again, this is one full whole 10-number question that includes drawing, includes labeling, that includes narrating this particular brachial plexus, and as well as writing in this particular clinical problems related to the brachial plexus. Now, coming back to this particular writing part. So, whenever you are answering any question which is having credential more than 2, like 3 or onwards, any questions, whenever you are addressing, be it clinical explain why, be it short note, be it is a fragment of a long question, just answer in a manner which is systematic. You have to put introductions of the structure, what you are going to write, introductions or kind of definition, then you have to narrate the thing, what you are going to write about anatomy, then you have to write or just like a draw a schematic or any picture with proper label and diagram included, and then you have to explain it if it is explain why, and then you have to just like write the clinical thing related to it, justify why this is happening this or what clinical relevance this particular structure anatomically has, and then if that particular structure has got something embryology to do with, you have to write 1 or 2 words about this embryology. So you cover it in a whole 5 or 6 domains whenever you're writing. Unless until you miss any of the domains, you are losing the marks. So in a 3-mark question or be it a 5-mark question, if you are not following this pattern, you are missing something. So practice rigorously writing about this particular long questions, short question, explain why, which you all have performed miserably. So that's a very poor performance in the write-up section which you have. We haven't introduced this the MCQs yet. So the MCQs is easy to answer compared to this particular short notes, compared to this particular explain why kind of thing. But if you have to explain something which is like a majority of the question is going to be in a theory discussion, it is going to be a structured answer way you have to answer. But anyway, so for the day we are going to talk about the brachial plexus, that's a part, and we are going to divide the sessions like we are going to see what brachial plexus is, how these particular branches are present, then we are going to draw it and draw it and practice in a way so that even I wake you up in the middle of night and ask you to draw this diagram, you should be able to, oh Dr. Chaudhary, this is, then let me go to sleep. So it should be at the spinal level whenever you are drawing this, and why we should be doing this, because it's a very hot topic for your exam lecture question. So coming to the brachial plexus, so why do we need this kind of plexus around this particular arm or this particular upper chest region? Reason is that we have a tons of muscle which is supplying our arm, our forearm, our palm, and as well as the shoulder region and as well as the back region. So we need a motor supply to the muscle who are doing the intrigued, sophisticated works of our fingers. So we need a very intrigued networks of nerve plexus existing to this. To supply them, we need them. Moreover, we have the skin on our parts of the arm, forearm, and this particular hand region. We have to supply the skin. That means the sensory supply we have to put to that. We have tons of joints are there, shoulder joint, we have the elbow joint, we have the wrist joint, we have the finger joint, which is very, very, very delicate. Yeah. If you lose any joint functions on our fingers, you can understand how important it is to hold the pain, to do the works and day to day. This is because the hand is the thing which earns the bread and butter for us. So we need a very delicate and very precise nerve supply to this region. So we need this particular brachial plexus, which is a nerve plexus existing in our upper part of the body, to supply this muscle supply, to supply this particular sensory supply to this particular skin and the joint supply. So this is the purpose of knowing or having this kind of plexus. Now, we have to know what this particular plexus is making up. So we have to know the situations of this plexus, where exactly this particular plexus. We have to dig this particular plexus out to see how this particular plexus are forming and how these plexus are coming out. So this particular plexus, basically, it has a long course. You can see it starts from the neck region. This is the neck region bones, cervical vertebrae. And this is the thorax region. And this is the axilla. And we are in the axillary region. And we see that this brachial plexus formation takes up high up in this neck region. It starts forming there and courses down to this particular neck and this upper limb and the thorax junction, and then it moves to this particular joint or this region. We call them the axilla. Now we are doing the axilla. We are seeing this particular plexus of the brachial plexus region in this axilla dissections, but it starts from the neck region. In the neck we have a space, we call them as triangle of the neck. It is situated in the back side of the neck. We have the muscle in the neck, right? SCM, we learn about the SCM attachments on this manubrium sternae. Behind this SCM, sternocleidomastoid, we have this particular plexus starting over here. Then this particular plexus, anastomose or kind of exchange this particular thing, and then it comes down and breaks down and rejoins and unites and forms given branches and enters to this particular axillary region, crossing over this clavicle and this particular scapula on the back side, and in between them it is rooting to this particular axilla. Now if you can recall, the axilla has an apex of the axilla and has a base of the axilla. In the dissection we have removed the base of the axilla to see this, to reach to this particular axillary cavity. So this particular thing enters to the axilla through the apex of the axilla, then it courses through the entire length of the axilla, then it grows to this particular lateral wall of the axilla. Now we remember, we talked about this particular axilla, have got walls, anterior wall, posterior wall, lateral wall, medial wall, and has a base and apex. These are the simple things we talked about. So this is how this is coursing. We have seen part of these nerve plexus which is present in the axilla already, and we are seeing that how these things are coursing. In the neck region, it is present between these two muscles. These two muscles are familiar to us. We call them as miscellaneous anterior and miscellaneous medius. So if you recall back, we learned about this rib. And in the first rib, we have a notch. And many of time, whenever you are given this notch, rib 1, we ask about this particular question, scalene tubercle. What is scalene tubercle? What attaches to? So this miscellaneous anterior attaches to the scalene tubercle. And on the back side, we have another muscle, good, bad and ugly. Scalene have 3 brothers. miscellaneous anterior, miscellaneous medius, miscellaneous minimus. So this is the two between the miscellaneous medius and the miscellaneous anterior. We have this particular brachial plexus trunk moving down and coursing to the apex of the axilla. So this is how this particular brachial plexus starts its journey. Comes from the neck, posterior triangle, crosses this clavicle and this particular scapula, enters to the apex of this particular axilla, and this particular thing comes down and courses through this particular axilla and then branches out in smaller branches and supplies different muscles. So this is the entire length or entire story about the back. All these things are coming out. Now, talking about the nerves. Now, coming back to this particular thing, it's a quick brush up of things. This is the spinal cord. The spinal cord has a gray matter and the white matter. If you can remember that, the gray matter has a H-shaped structure, and this particular H-shaped structure has got two parts. One is this one is this one. We call them as anterior end of the gray matter and posterior end of the gray matter. From this anterior end of the gray matter and the posterior end of the gray matter, there are spinal roots coming up of the spinal nerve, dorsal root and the ventral root. So these are the two roots coming up. Remember the words I am using. We are using the word as a root of the spinal nerve. So this particular two roots comes together, joins together, makes a wholesome spinal nerve. Now again, the spinal nerve splits into two rami. One is moving to the anterior side, we call them as ventral rami. You see the thickness. This is whole thickness of the bunch of these nerve fibers coming here. And you look at this other rami or division, we call them as dorsal rami. So ventral rami and the dorsal rami, see how skinny these dorsal rami are. The dorsal rami goes to the back side, supplies the muscle in the back region, supplies the skin on that back side. And the ventral rami, see how thick it is. All the nerve fibers moving to here. So this ventral rami, which is coming from the spinal nerve, C5, C6, C7, C8 and T1. They are coming together and uniting and making this plexus, which we call them as the brachial plexus. Clear? What is ventral rami? What is dorsal rami? What is ventral root? And what is dorsal root? Don't get mixed up with this. Alright, so you should have a very clear idea about what do you mean by the root and what do you mean by this rami. You don't get mixed up with these particular things. Now, so this is the skeleton of the formations of the brachial plexus. The nerve fibers or ventral rami of the C5, C6, C7, C8 and T1 commonly unites and makes this particular plexus, which is known as the brachial plexus. Alright, so we'll see how these things are coming. So this is like a kind of like a 99% of cases, these are the nerves which are making this plexus. In some of the cases, maybe some additional nerve, one nerve above or one nerve below, making or contributing to this formation of the brachial plexus. Then we call this kind of brachial plexus as prefixed brachial plexus or postfixed kind of brachial plexus. So in case of C5, we may have the contributions of some of the individual, maybe from the fibers of the C4. So C4, C5, C6, C7 and C8. These are the nerves forming the brachial plexus, and C1 fibers are excluded out. Maybe less than 1% of individual may have that kind of brachial plexus formation. That kind of brachial plexus formation, we call them as prefixed type of brachial plexus. Less than 1% may be having a brachial plexus formed by the ventral rami of C6, C7, C8 and T1 and T2. Spinal nerve, ventral rami. Those kind of brachial plexus, we call them as post-fixed brachial plexus. They are very, very rare instances. We are not going to consider them. So what are the most majority of the things that the brachial plexus is forming? We are focusing on these particular things. So ventral rami of C5, C6, C7, C8 and T1 forming this particular brachial plexus. Starting from the neck region, posterior triangle. How do you know about posterior triangle? We do not know anything about. Only behind the SCM it is forming and rooting down to this particular clavicle, under the clavicle, entering to the axilla, to the apex of the axilla and getting into such kind of substance of this axillary region and forming the branches. And this is how this is forming over here. So this particular brachial plexus formation takes some kind of names over here that we have to know. So see that the C5, C6, C7, C8 and T1, these particular spinal nerve ventral rami we call them as roots or spinal nerve roots. So we call them as roots of the brachial plexus. Now the roots of the brachial plexus unite. They unite a particular pattern. Upper two unite C5, C6 forms a common root. We call this as trunks. Now this particular trunk, we call them the upper trunk. Now see that C7 do not unite with any of them. They are just like a loner. It stays there. We call them as the middle trunk of this brachial plexus. Now other one, which is ventral rami of the C8 and T1, these two guys again unite and forms a common root. We call them as trunk, as we have mentioned. This trunk we call them as lower trunk. So this is a union of the ventral rami taking place, forming from the 5, they are making 3 trunks: upper trunk, middle trunk and lower trunk. So this is the initial formation which is taking place in the neck region. Then each of them, upper, middle and lower trunk, splits into 2 equal branches. We call them as divisions. Now you see the divisions taking place, 1 and 2, 1 and 2, 1 and 2. We call these divisions as anterior divisions, posterior divisions. Alright. So these trunks, how many of them? 3. How these trees are formed? From this particular ventral rami of these 5 guys. 2 of them upper 2, 2 of the lower 2, uniting, making these 3 trunks. Then 3 trunks divides into 1, 2, 1, 2, 1, 2. Now 3 means 6. So we have the 6 divisions taking place. So we call these divisions as anterior divisions of upper trunk, posterior divisions of the upper trunk, anterior divisions of the middle trunk, anterior divisions of these posterior divisions of the middle trunk, anterior divisions of the lower trunk, anterior posterior divisions of the lower trunk. Now we follow here all the posterior guys, this posterior and this posterior unites together and forms the common posterior cord. Now these particular anterior divisions of the upper trunk, anterior divisions of the middle trunk, they unite, they form this particular lateral trunk. So this is another trunk, another cord which is happening. So this posterior cord, all the posterior guys uniting, forming the posterior cords. Upper 2, middle and upper anterior division unites to form this particular cord. We call them lateral cord. And this other one, which is this like the other one of the lower one, which is anterior division, which forms the another cord, we call them as medial cord. So we get these 3 cords, lateral, posterior and medial cords. So breaking down things are complex. So initial we have the roots, then we have trunks, then you have divisions, then as divisions unites in a particular manner. They forms this particular cords. All the posterior one unites to become the posterior one. The upper 2 anterior one unites to form the lateral one, and one anterior which is left forms the medial cord. So these are the 3 cords. So from these 3 cords there are several branches of brachial plexus are coming. So these are cords which are splitting into branches, and these branches are visible in the axillary region. So this, after these particular divisions and all these cords are formed, when you dig this axilla which you have done, you are seeing these branches of these cords which are coming out. So what are these branches of these cords are coming out? If you have a complete picture of them, this is what is coming out, these complex networks. So this onwards you can see these branches are coming out. So once again coming back to see what we have learned. So roots, yes, louder. Alright. So once again, roots 5, 6, 7, 8 and T1 uniting in the particular fashion. Upper 2, lower 2 unites. Forms 1, 2, 3, upper trunk, middle trunk, lower trunks. Then all of them splits, anterior division, posterior divisions. All the posterior unites together to form this particular posterior cords. The anterior divisions of this upper and the middle forms the lateral cords, and which is the undivided, which is ununited anterior divisions of the lower cord forms this medial cord. So these are the things which is forming here at these cords. This part up to this particular cords are hidden behind this particular clavicles. The branches of the cord starts appearing within this axilla. So there, each of these cords, lateral cords have got branches, medial cord have got branches, posterior cord have got branches. These branches becomes visible when you are digging this axilla. Actually, you are seeing these branches of the cords in the axilla. Let's come into this particular thing about this particular branches of the different parts of this particular region. We call them as cords. So let's focus in these cords first. So in the cords we say the lateral cords. Lateral cord gives three branches. We call them as lateral pectoral nerve. We have the lateral root of the median nerve and musculocutaneous nerve. These are the branches coming from the lateral cord, and we have seen them, all of these three. What are the branches coming from the medial cord? We have two cutaneous nerve, medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm, and medial root of the median nerve and ulnar nerve. So these are the branches, they are coming from this medial cord. We have seen many of them or all of them. Coming to this particular branches from this particular posterior cord. So posterior cord have got branches. We call them as upper subscapular, lower subscapular. We call them subscapular nerve together. There are two of them, upper subscapular, lower subscapular. Thoracodorsal nerve are placed in between them. Then we have the axillary nerve and the radial nerve. So some of the branches of the posterior cord we have seen. So we have seen this particular nerve, which is axillary nerve. We have seen this radial nerve. The upper subscapular, lower subscapular, thoracodorsal, these are deeply placed. But the thoracodorsal nerve we can see. This subscapular nerve we may see or may not see because they are posteriorly driven, posteriorly moving. Okay? So all these branches which are coming from this posterior cord, lateral cord, medial cord, that you have to know, and you should be able to draw them whenever you are drawing it in a schematic manner or in a picture like this. So you have to know about these particular names of the branches and all these branches, how they are going to supply the different parts of the skin. That is what we are going to identify. So this is what we have seen in the dissection sections over here. Now this is what we have seen here. So if you can recall back, this is the median nerve. We have identified the median nerve present to this particular lateral aspects of this particular artery, the brachial artery or axillary artery. Lateral to that, median nerve. So remember that we said that the median nerve on the up splits into Y. Remember that we say that, we check it, we say that this Y, why this Y is there? Because they are coming, the median nerve is formed from this particular contributions of the two cords, medial lateral cord and this particular medial cord, both of them contributing to form this particular median nerve. So we call them as lateral root of the median nerve, medial root of the median nerve, and contributing, joining and forming this median nerve. So this is what we have done. Now this is the formation. Roots are over here. You see that 1, 2, 3, 4, 5 in the neck region. Then we have this particular thing which is joining over there, trunks. Then it trunks again splits into anterior posterior divisions. Then it courses over here. Then it's forming this again posterior cord, lateral cord, medial cord, and then it splits into branches. This is the branch, if you can recall back, this is happening into this particular muscle. What nerve is this one? Musculocutaneous, and this muscle is coracobrachialis. So this is the way we can identify it. So this is a lateral cord. So this is the other branch of lateral cord. So this is lateral root of this lateral cord which is going to supply to this formation of this median nerve. So this is another nerve, and the lateral pectoral nerve. You see this nerve, you have seen already the lateral pectoral nerve. So going to supply to this particular piercing to the clavipectoral fascia. Similar to this, we have this particular another nerve which is forming over here, which is the ulnar nerve. We have seen that, right? It is present on this particular floor side of this particular thing. We have seen that ulnar nerve forming over there. This is the two nerve which is cutaneous, medial cutaneous nerve arm, medial cutaneous nerve of forearm. They are coursing like this. This is the nerve, medial cutaneous nerve arm, and coursing down medial cutaneous nerve of forearm, right? So these are the branches we have seen. An axillary nerve which will be like a deeply placed, dig inside. So this is how we are going to do. Now, we stop at this point. I want you to just like close everything. Take out your pen and pencil and draw with me what we are doing. Okay, so we have to draw the brachial plexus in less than 1 minute time. Can you do that? All the branches. We are going to draw 18 branches of brachial plexus in less than 1 minute. Is it possible? Possible? Yes or no? No. But you are going to do that. Alright? Alright. Ready or not? Get a pen and pencil out. White piece of paper or ruled paper. Take these things out. Close everything. So who is going to beat me? I'm going to draw the brachial plexus. Who is going to draw faster than I can? Alright, first I train you and then I'll just like make a competition. Alright. Fair enough. Okay. Ready? All the sleepy, lazy heads. Pen? और मोबाइल मुझे दे दो. और मोबाइल मुझे दे दो. मैं तुम्हें देख नहीं रहा हूं. Pen, pencil, whatever you have. Have any pen and pencil left? Pen, pencil? No pencil. Pen? Okay. So, I'm going to draw easy, nice and easy. So, draw to me. C5, C6, C7, C8, T1. Nice and easy. Come on. Easy drawing. Modern art. Who can make it out? So this ventral rami of the C5 to T1 you have drawn. Okay? Okay? Done. Now we are going to join it. Upper 2, lower 2. Upper 2 and lower 2 joins. After joining, what does it make? Trunks. Okay. Trunk 1, trunk 2, trunk 3. Okay? Good? Easy so far? Easy so far? Again. Once again, begin with this. 2, 3, 4, 5. C5, C6, C7, C8, T1. 1, 2, 3, 4, 5. Upper 2 unites, lower 2 unites, forms this 1, 2, 3. We call them as upper trunk, middle trunk, lower trunk. Good? So what happens with the trunk? You're going to split. It's going to divide. So each of these trunks going to divide, going to split. What this thing is splitting into? Anterior division, posterior division. So you use two different colors for these two divisions. So anterior division, anterior division. Posterior division, posterior division. Okay? Okay? What happens to this? After these divisions, anterior divisions and the posterior divisions. Oh, come over here. Two of you come over here. You two, come over here. Come over here. Come over, second bench. तुम दोनों इधर में आ जाओ. Second में. Hard one. इधर मिल जा रहा है. Go to that one. So all the posterior divisions. This color I have used the posterior divisions. They unite. All the posterior guys unite. Forms this posterior cord. Anterior upper two unite. They form the lateral cord. So anterior upper two unites, the upper trunk and the middle trunk unites to give rise to this particular lateral cord. And this one is left to form the medial cord. Okay? So now we get this particular cords, lateral cord, medial cord and the posterior cord. So three things we are coming here with. Starting from the 5 guy, we ended up into 3. We have initially 5 spinal nerve, ramifications, roots, and eventually coming into it. Okay? So once again, we redo the thing from the beginning. C5, C6, C7, C8, T1. 1, 2, 3, 4, 5. Upper two unites, lower two unites, and splits into 2 branches. Each of them, all the posterior ones unite to form the posterior cord. Upper two unite to form the lateral cord, and this one with the medial cord. Again, draw it from the beginning. Flip the page, come to a fresh page, again you do it. Flip the page without seeing it, whatever you have drawn so far, get in a face page, then you again redo the thing. It's only thing you can do by repeating and redrawing, again drawing. This is the thing which you are going to master, because this is so far, it is really simple. So now the story is going to be complex on, as I'm just like putting this thing. So far we are here. So roots, we have 5. Then we have these trunks, upper trunk, middle trunk, lower trunk, anterior division, posterior division. Then we have this particular cords, posterior cord, medial cord, lateral cord. These are the 3 things we have drawn so far. We haven't gone yet. We are going to draw, remember, 18 nerves out of these. 18 of them. Remember 18 of them. So without looking at it, you draw it. So 5 first, C5 to T1, then upper 2 unites, lower 2 unites. The middle one goes as it is. We form the upper trunk, middle trunk, lower trunk. Each of these trunks splits into 2 divisions, anterior division, posterior divisions. All the posterior unite, posterior cords. Upper 2 divisions of this upper trunk and the middle trunk, anterior division unites, form the lateral cord, and whatever is left with is forming the medial cord. Okay? Good? C5, C6, C7, CH, 1, 2, 3, 4, 5. Lower 2 unites. This one forms this upper trunk. This one is middle trunk. This one is the lower trunk. Each of them splits into two divisions. The posterior divisions is this one. This is the P for posterior. So all the posterior eventually unite to form the posterior cord. Then we have the anterior divisions. The upper two anterior divisions unite to form the lateral cord, and which is not united goes as medial cord. Okay? Reach this far? Now, I take this particular lateral cord first. This is because this is the easiest one. We have three nerves to remember which are coming from the lateral cord. So, the main continuations of the lateral cord is going up as a nerve. We call this as MCN, musculocutaneous nerve. We have a nerve coming from this one. We call this as lateral pectoral nerve. And we have contributions over here. We call this as lateral root of median nerve. So these are the three branches coming from this lateral cord. Lateral pectoral nerve. We learned about it. The main continuation goes down, musculocutaneous nerve. And the third one is contributing half of the formation of another big nerve which is known as median. Median with N, median nerve. We call them as lateral root of median nerve. Okay? Good so far? Okay with this? So how many branches lateral cord has? 3. Lateral pectoral nerve, lateral root of median nerve, and main continuation down as musculocutaneous nerve. Okay? Good. Now let's move to this particular middle guy. Middle cord. So it has 2 sensory nerves which is going to supply the medial aspects of the arm, medial aspects of the forearm. So we call them as medial cutaneous nerve of arm, medial cutaneous nerve of forearm. They are cutaneous nerve, sensory, purely sensory. Medial cutaneous nerve of arm and medial cutaneous nerve of forearm. Then, if you have the lateral pectoral nerve, we have the medial pectoral nerve. So we have medial pectoral nerve, which is coming from this particular medial cord. Then we have the other half of median nerve. So this is joining with the lateral one. We call them as medial root of median nerve. And eventually, they make this nerve, we call them as median nerve. So these are 5 branches, 2 sensory, medial cutaneous nerve of arm, medial cutaneous nerve of forearm. One is pectoral, lateral pectoral from the lateral cord, medial pectoral from the medial cord. Other is the median nerve itself coming from 2 sources. So lateral source and the medial source. They are coming from 2 different cords. They are uniting to give this entire median nerve. So everything coming together. So we have 1, 2, 3, 4, 5 branches coming from these medial cord. Good? 3 from here, 5 from here. Okay? Finished it or not? Getting it or not? You are with me or not? You need any stimulant to energize? You need another more nap or sleep? Want to go home? Run away from here? This is your chance. Okay? Okay? Flip the page. Get a new page. Don't be a miser. Don't look at it. Don't look at this just like you are spending too much of papers and wasting it. Get a fresh page. Get a fresh page. Don't look at whatever you have drawn. Okay? Fresh page. Everybody, come with a fresh page. कंजूसी मत करो यार. तुम नया पेज निकालो. हाँ, चलो. All right, ready? Once again, back to basics. 1, 2, 3, 4, 5. C6, C7, C8, T1. 1, 2, 3, 4, 5. Lower 2 units, upper 2 units. The middle one, do not. Upper trunk, middle trunk, lower trunk. Then it splits. Posterior divisions. All the posterior guys goes to the back side, posterior cord. Anterior divisions. One anterior divisions, upper one and this one. Unite. Forms this lateral cord. And this one becomes medial cord, lateral cord. Coming to the branches of the lateral. Don't look at my drawing. You are copying it from me. You shouldn't be copying from me. You should be writing from your mind. Lateral cord. We have this particular nerve, which is known as lateral pectoral nerve. Then we have this particular lateral root of the median nerve. Then we have the MCN, musculocutaneous nerve. The medial root have got 1, 2. Medial cutaneous nerve of arm, medial cutaneous nerve of forearm. Then we have this medial root of the median nerve. Then we have this medial pectoral nerve. Am I finishing first? Am I finishing first? You're still lagging behind. I'm 44 years old. It's senile atrophy, which I'm getting. My brain is half working, half than your strength. But still, you are behind me. How many are this? 5 from the middle, 3 from there. So we are left with this particular posterior cord. Are you going to learn the posterior cord or not? Ulnar nerve? Okay. So, posterior cord. So we have again 5 nerves on the posterior cords. So I am taking the posterior cord. You are done with this lateral cord and this particular middle cord, right? Everybody? Okay? So posterior cord again we have the 5 one, right? So you have to remember or memorize this sequence of this particular posterior cord. 1, 2, 3. 1, 2, 3, like this. The upper subscapular nerve. Upper subscapular nerve, lower subscapular nerve, and in between them we have TD, thoracodorsal nerve. So you have to remember this sequence, how they are coming out from this run. So upper subscapular nerve, thoracodorsal, lower subscapular. They are supplying the subscapularis muscle and teres major, and thoracodorsal they are supplying the lat, the latissimus dorsi. They are the back muscle they are supplying. The posterior cord, that means they are going to supply the back side of the body. So this posterior cord is principally supply the back side of the body and the back side of the arm. So these are the three which is going to supply. Then the fourth one, AXN, axillary nerve, and the main trunk goes down, RAD, radial nerve, 1, 2, 3, 4, 5, upper subscapular, thoracodorsal, lower subscapular. They are supplying the scapularis muscle, they are supplying the back muscle, thoracodorsal, which is supplying the lat muscle, the hangers muscle, and they are going to supply this, the deltoid region, the teres minor, the back side again, the axillary nerve and the radial nerve, everything on the back side of your arm, forearm. Any muscle you have on the back side of the arm and the forearm, triceps or any extensor muscles which is present on the back side, they are going to be supplied by the radial nerve. The radial is all the back. The sensory supply, the cutaneous supply, everything on the back of the arm, forearm are coming from the RAD, radial nerve. So 5 of them. Okay? So 5 of these. 3, 5, 5. Remember them? Okay. So now coming to these roots. There are 4 additional nerves that are coming from the roots or these particular trunks that you're going to learn. So this is 1, C5, C6, C7. From the roots, we have a nerve coming down. The long nerve, we call them as long thoracic nerve, LTN. From the C5 root, we have another nerve which is supplying on this region. We call them as DS, dorsal scapular nerve. From this upper trunk, we have 2 additional nerves. One is above, one is below. So below one, we call them as NS, nerves to subclavius. And upper one, we call them as suprascapular nerve. So this is the entire story of all the brachial that we have to learn at this level. So we number this 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. So I am not putting the numbers in exact way it should be, but 18 nerves we are going to learn. 18 nerves we have drawn. So 5 from the posterior trunk, from the roots and the upper trunks. These are the 4 that you have to memorize, that you have to remember. So first thing you have to memorize or remember the names of the nerves. The second thing, you have to memorize what are the muscles they are supplying. So this is the one which you have done. So once again, get a fresh page. 50 times, it stays with you for the spinal level. Trust me. Get a fresh page. We're there, we are there. 5 more minutes. 5 more minutes. One last time. One last time. Okay? Alright, who can beat me? Who can beat me? It's a shame. It's a shame. It's a shame. You, you are unable to beat a veteran, 40 years old, 44, halfway there in the coffin. All right. 1, 2, 3, 4, 5. C5, C6, C7, C8, T1. Upper 2, lower 2 unites. Anti-division, posterior division. All the posterior one comes together, forms the posterior cord. The upper 2 becomes the lateral cord and the medial cord. So from C5, C6, C7, we have this nerve, we call them as long thoracic nerve. And from here we call these as dorsal scapular nerve. Then you have 2 here, nerves to subclavius, suprascapular nerve. Lateral pectoral nerve, musculocutaneous. Lateral pectoral nerve. Lateral root of median nerve. Medial root of the median nerve and the median nerve. We have this medial pectoral nerve. We have this medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and we have this ulnar nerve. 1, 2, 3, upper subscapular nerve, thoracodorsal, lower subscapular nerve, radial, and axillary. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. Done. Good job. Good job. 50 times. Okay. So we are yet to start the story about it. It's just a beginning. And then you know about this particular nerves, you have to know the nerve supply, the muscle they are supplying. Then you have to know the lesions. That is the question. So the long question will be the draw and label the brachial plexus. 5 marks will be there. Discuss about the clinical lesion involving the upper trunk or lower trunk. That will be 2-mark question. You have to discuss that. And then you have to narrate this injury which is related to these particular nerves, which will be another 3-mark question. So it will be a question. And this particular draw label includes the location, extent, nerve which are forming over here, and this schematic picture of this guy. So that's why I'm saying everything in a less than a minute. That's how you have to practice to save the time. And this is easy. Once you get it, it's just like a maths. You write it and get this everything together. So 50 times, it will be there, trust me.